Yesterday, I went through the biological principles and the evidence, the clinical evidence that supports our understanding of placing implants into post-extraction sites. And today, I'd like to then follow on by the relevant clinical application of that evidence. We know what happens after teeth are taken out. So now it comes time for us to decide when we place the implants and at what time frame. And I always like to start with this slide when we talk about clinical techniques. What we want to do is to provide a predictable long-term outcome for our patients with minimal risk. And therefore, if we're looking at placing implants into extraction sites or into post-extraction sites, we have to have that understanding of what are the disadvantages and what are the advantages of each of these techniques, which I shared with you yesterday. And that then becomes the basis for deciding on the optimal outcome that provides us with this objective of providing least risk with the best outcomes. So I'll speak about three things. Firstly, I'll speak about the classification of implant placement after tooth extraction. I will go through briefly the clinical recommendations of the ITI, and this is at the last consensus conference, which outlines clearly the steps involved for selection criteria for implant timing. And then I'll look at this selection criteria in practice, and I'll do this by demonstrating these principles in some clinical cases before we end the lecture. So firstly, the classification for timing of implant placement is now actually very simple. It is now based on what the clinician, in other words, you and I, what we would like with healing after a tooth is taken out. So what the desired clinical outcome is. And the entire classification is therefore based on this. So either it's a fresh extraction socket,